But as I was talking to many of you about earlier, a stress is due to what you think a stress is. This enigma, this amorphic thing called stress is different for each person. Some people get stressed out thinking about skydiving. Others get stressed out when they see a spider or a bat, my mother. Some people stress out with their partners. I bet that's probably more stress than skydiving for some of you. Several studies have been done showing that students who are test taking during final exams, their immune system drops significantly, and this is the reason why you have so many colds and flus around final exam period. It's the perception of what's going to happen if they fail that test. All right, here's an old timer for us. This is one of my favorite doctors in the mind-body approach, Dr. John Sarno. He has almost 60 years of clinical experience. Now, in my impression, my perception is a guy that looks this traditional shouldn't be talking about mind-body medicine, folks. I mean, doesn't he look like your old school doctor? He has an 85 to 90% success rate, some of the best in the world. 85 to 90% success rate, some of the best in the world, with pain primarily and other symptoms associated, and he uses no surgery, no drugs, not a single supplement. He just talks to you for a weekend. And these are the findings that he's found over the last 60 years as a doctor. And believe me, he's been scrutinized by all of his other specialists. But you can't deny a 90% success rate. He feels they come from three sources. Emotions from childhood, it's often anger and rage. The need to be a good little girl or a perfect boy and get good grades and be the perfect mother, the perfect father. Always good, always good, always good. And then real life, everyday stresses, bills, filling your car, mortgage, whatever. Through the stress response, which we just saw, what happens is the brain is actually creating this pain to take your mind off of these things. The brain is creating the pain so you don't think about the stresses in your life. And it does this through some very important chemicals. What it does, when that stress response started, like I told you, it takes that blood and it moves it into the big muscles. So what we have is a decrease in circulation, which causes a decrease in oxygen. That as well causes an increase in lactic acid. Lactic acid is that acid that we feel after we run really hard or we work out really hard. It also increases substance P. Here comes that word. It's coming back to talk to us again. And we're going to be talking about it quite a bit here shortly. This is felt physically as pain, numbness, weakness, tingling. Every cell requires oxygen. In fact, when the heart is having what's considered to be a myocardial infarction or a heart attack, the pain of a heart attack is because the heart's not getting any oxygen. And there's not a single pain medicine that can take care of that. Just a dilator to open up your blood supply. The majority of my patients that come in to see me for aches and pains that have been treated by chiropractors, been popping pills for medication to reduce the pain, have been going to massage therapists, even considered drug therapy and or surgical therapy. The majority of them, the pain came out of nowhere. There was no major trauma, there was no major accident that had occurred within recent time. It was something really simple they did, like bending over, sitting kind of weird, moving too quickly, and they might even have heard a noise. So therefore they associated that with the reason why they have their pain. And Dr. Sarno goes to talk about the multiple factors that he has seen affected by this: back pain, neck pain, shoulder pain, fibromyalgia. Every single fibromyalgia patient case I have had, every single fibromyalgia patient I have ever had has had a stress response element. Thoracic outlet, which is the numbness and tingling in the fingers. A lot of people talk to me about that. Leg pain, sciatica, bursitis of any joint. And even if you're told you have arthritis, you have disc problems, You have stenosis or stress fracture. Let me tell you why. Now, this study is amazing. It makes me laugh just looking at this. I just can't believe it. Okay, so there was first of all, how many people do we have in this room? About less than 100, right? So let's put every single one of you in a study. Got it? And every single one of you here, not a single one of you has back pain. Okay, that's what we're going to say. You're all free of back pain. Not a single ounce of back pain. Yes, and I'm doing this because we're telling you right now, you see, we're telling your brain that there's no back pain. Wasn't planned, but could be. With this 98 subjects, 36% of the non-pain subjects, only 36% of them had a completely normal spine. 64% of them had changes which, when looked at on radiographs by orthopedic surgeons, the orthopedic surgeon said this person needs surgery. 52% of the subjects had a bulge at least one level, a bulge disc. 27% had a protrusion, 1% had an extrusion, and 38% had an abnormality of more than one disc. This is in a room with 100 people with no pain at all. And the final quote was, the discovery by MRI of bulges or protrusions in people with low back pain can frequently be coincidental. Well, that's a real pain when we consider that somebody's, at least 250,000 of you a year are spending $6,000, or your insurance company is spending a whole lot more of it for these surgeries. Right here is what we see. We see a lumbar surgery opening up the spine. So this was a 2-year period, and what they did is they had one group that got surgery and they had one group that didn't get surgery. Interestingly enough, what would you expect? Well, patients in both the surgery and the non-surgery treatment groups improved substantially over a 2-year period. So, because as we talked about earlier, these placebo studies that they did back in the 70s, these sham studies where they cut open the guy's chest and open it up and sewed him back up, they're not allowed to do anymore. That's an expensive placebo act, but I'll tell you what, if it works, it works. I got a gut feeling about this one, and I do. Because the density of receptors, which are the locks, and the neuropeptides, which are the keys, are so dense in your gut that it's like you have another brain there. That's pretty crazy. I mean, why would we want a brain in our gut? What's the point? You know, the ancients knew this. The word melancholy comes from melon, which means black, choly, which means bile. And it was commonly understood that when they did autopsy on patients that were depressed, they had a black, thick, congested bile. Very interesting. And Dr. Pert goes on to say that these messages don't just go one way. They go back and forth. In other words, if there's emotional pain, we can cause physical pain, but also if there's physical pain, we can cause emotional pain. And people that have digestive imbalances, they have dyspepsia, and they can be related to a dyspeptic person or an irritable person. These neuropeptides that induce pain due to stress, as we said, are also found in the gut. The very same molecules that your brain uses to feel emotion, like anger and anxiety, and to remember, those very same molecules are found in the gut, and their names are follows: serotonin, NPY, VIP, and substance P. These molecules are not going to affect one area solely. They will be bidirectional and affect both of them at the same time. There were 9 studies, this actually goes way down here, that have proven 9 consistent long-term studies that found irritable bowel disease, which is a huge situation in this country. Colitis, Crohn's, irritable bowel syndrome, and reactive diarrhea have proven that stress is a major component of this illness. And if we look further at anxiety, depression, and pain, emotional stress, when you're under stress, we actually increase substance P, which we learned earlier is the main language the brain says pain. These substance P elevations will also depress your immune system for up to 3 days after the stressor exists. And now the research is very thick, showing that both anxiety and depression could potentially be due to substance P elevations. But we got our heads in the sand. And what do I mean by that? This is one culture that can't handle pain, and especially we don't want to feel sad. And certainly we don't want to have someone else tell us they're not feeling good. How are you doing today, Lauren? Oh, I'm fine, thank you. I would probably be shocked if she said, I'm feeling like terrible. Because it doesn't happen, you see? It's not allowed. It's not allowed. It's a psychological, social norm to be fine. I'm good, I'm fine. Paula, you're laughing, but you know it's the way it is. So, we often will cover them up with medications because it's not okay to be depressed. It's not okay to be sad. And what we do is we go to the doctor, doctor, I'm sad, get me out of this, help me out. What do they give you? They give you a drug, make me feel happy again. But guess what? It doesn't always work that way, does it? And we will use many things to cover up our pain. Pain meds, sleeping pills, this is where all addictions come from. This is where all addictions come from. Food, drinking, smoking, sex, I don't care. This is where the addiction comes from. It's from pain. And the pain isn't wanting to be felt. But now so many treatments, their treatment guidelines are not to avoid the pain, but to accept it. Be okay with it. Allow it to flow through you. Stop resisting it. And guess what happens? The depression goes away. How many people feel like this after this last month? Again, I won't get political. I could, but I won't. And headaches as well release substance P and serotonin, those 2 neuropeptides that we learned about, which are responsible for anxiety and depression. Isn't it interesting? So many of my patients that come in with headaches are commonly, you're going to find an association with some type of emotional stress that has happened. I pulled this up. I think it was very fascinating. Interestingly enough, these neuropeptides, particularly the ones that I want to talk about, are glutamate and aspartate. These are 2 neuropeptides which our body uses to move muscles, to create pain. And interestingly enough, these artificial flavors from MSG, monosodium glutamate, and aspartame, kind of sounds like aspartate. And don't forget about Splendo, which people think is just fine, but it's not. These are neuroactive chemicals. They're acting like the peptides in your brain, and therefore they can stimulate pain. It's very, very, very important to recognize that if we are able to reduce them, some of our symptoms may just disappear. And finally, this talk would not be complete without talking about the cycles, the rhythms of life, day to night, new moon to full moon. All of us animals are on the governing of these cycles. We secrete cortisol and serotonin in the morning and growth hormone and melatonin in the evening, and this has to happen every single night for proper function. Not entering REM sleep. Now, REM sleep means rapid eye movement. It's what happens when we dream, and we go through it several times during the night, okay? And what studies are showing is that REM sleep is a time when the body is regenerated, per se. Not going into it can actually cause an imbalance in cortisol, which is a stress hormone, for up to 24 hours later, including growth hormone as well. Which means if your stress is stopping your sleep, you are now in a vicious cycle. And for those people that are using drugs, such as any of your sleeping aids or alcohol to medicate themselves so they fall asleep, have you ever realized that when you have potentially a hangover and you wake up in the morning and you just feel so tired? I'm so tired. That's the lack of REM sleep because it didn't allow your body to go into it. And the next night, guess what? You'll fall asleep just like that because the REM sleep will compensate the next day. That's how important it is. So we talked about a very few examples, but as I was mentioning, this talk could go on for 3 days. The research is huge, and it's so extensive, literally. These neuropeptides, these locks and these keys are having communication that is resulting in multiple symptom pictures. We talked about stomach pain, we talked about headache, we talked about insomnia, chronic fatigue, mostly from that sleep deprivation situation. But how many people have thought about their low thyroid condition being related to this? Very commonly is. When a person gets in a car accident, you will see a decrease in thyroid function and an increase in cholesterol. Isn't that weird? And often they can have an increase in blood sugar. Scientific studies will show that in high stress conditions, hyperglycemia, higher cholesterol are 2 factors that occur with cortisol release. Weight gain, of course. Infections, we recognize that high stress hormone can suppress the immune system. Cancer, I wrote my doctoral thesis on it. It's a very important component of treating that situation. Memory, of course, skin disorders, all arthritic joint ailments, asthma, allergies, and autoimmune system. Why are those involved? Because those are all mediated by the immune system. And if cortisol is high, if adrenaline is high, immunity goes low. And finally, male and female hormone balance. Of course, sexual side effects commonly are related to stress, menstruation difficulties, irregularities, and how many patients I have that come in with hot flashes that are getting no results with their hormone therapy. It's because the stress is creating it. And once we mediate that, they see great improvements. So I'm going to give you a couple of my personal case situations. These are fun. 40-year-old woman comes into me complaining of multiple years of history of relying on medications in a failed medical system for long-standing irritable bowel. It's gotten so bad she is losing weight and blood. First of all, we have to make sure that all the necessary precautions have been made and there's nothing serious that needs to be addressed. And after we did that, we found that she was completely unhappy about her work and her home life. After we processed this, talked it through, and she talked it through 1 week later. 1 week later, 7 days, several years, 7 days compared to several years, her symptoms have fallen to very minor. There must be something to do with this emotional balance thing. Another case, a young man comes in, hives on his body. Hives are welts. Like being stung by a nettle, you get these welts all over your body. Boy comes in with hives that started a month prior, and the dermatologist recommended steroids and some topical creams, which still had not worked. Well, we find out that young little man was rejected by a cutie pie at school, and it was happening about the same time these skin things started to sound a little bit fishy to me. I don't know. When you start paying attention to these things, they just have too much correlation involved. After we got through this situation, we got to the feeling behind it. 1 week later, everything's better. I can't believe it. 3 weeks later, he says, I admit there's a connection here because I saw her again, and when I saw her, I broke out all over my body. And then I did what we talked about, and it was gone. Is that amazing? Is that amazing? This was one of the most amazing cases I've ever seen, and truly I think that, remembering back to this day, I was worried myself when I saw this patient. 33-year-old female athlete is accompanied by a very worried family with symptoms that were undiagnosable so far. Been to several neurologists. They said, who knows? We don't know what's going on. It might be a possible MS. including weakness of the legs and arms, laziness of the eyes, and unpredictability of the bowels and stomach aches. And as an athlete, she was incredibly worried about her ability to ever perform again. The level of fear was so high. She literally shook while she talked about her situation. What we found out is there was an incredible amount of grief over a family member that had not been processed, and they all kind of coincided together, but it was never asked before. So we processed it. Actually, we talked about it significantly. 1 week later, the patient walks in with a skip in her step and a smile on her face. She walks in alone. She is thoroughly convinced that having some closure over this situation is what made the difference. She comes back 3 weeks later, still no return of symptoms, and now she wants to heighten up her competitive level. And this is a darling story. So, 25-year-old male comes in with multiple symptoms. This kid, headaches, I have digestive problems, I can't sleep at night, I'm depressed all the time. Jiminy Christmas, one more thing. What can we work on first? There's so many, where do we start? I'm digging. Okay, when did this start? Where is it coming from? Is there any emotional stuff? There isn't. Nothing. We can't find anything. And so I said, okay, so here's the lab test, because if you've been to me before, you know that I run metabolic testing, which tests your urine, your saliva, and finds out if there's any chemical imbalances. And there were multiple in this young man. I said, all right, we're going to focus on diet, nutrition, and a few supplements in order to get this body on track according to his chemistry. Well, 3 weeks later, I reran the labs.